Hello friends, this is Dr. Anand Srivastava, Chairman and co-founder of Global Institute of Stem Cell Therapy and Research, that is California, San Diego-based institution. And let me tell a little bit about our institution, and I'm going to share my screen with you guys. So the Global Institute of Stem Cell Therapy and Research is formed with a vision to cure the human diseases with regenerative medicine. So today I'm going to share our wonderful publication which came this year, in fact, in very good journal, that is Stem Cell Research and Therapy. And today I'm going to talk the possibility of the treatment of COPD, which is a lung-related disease. And I'm trying to see in this publication that is it possible to really manage or treat the COPD using the stem cell. And when I'm telling stem cell, there is several kinds of stem cells. But today I'm going to talk about a particular kind of stem cell that is called mesenchymal stem cells, which is well known for its immune modulations. And when I'm talking about COPD, so you know, today the world is really suffering, entire world in fact, suffering from the pandemic called COVID-19, and that is also affecting the lung very severely. So first let me talk about this COPD. Then first point comes, how and what are the causes? What are the main factors which causes the COPD? So if we see, and we know already that COPD is respiratory disease where the lung is severely compromised. So when we smoke some toxic gases or toxic things, or we inhale the toxic gases and toxic things and smoke also, then our lungs triggers very strong inflammatory reaction. So what are those inflammatory cytokines which causes this problem? So we know that those genes related to these triggering of these inflammatory cytokines are like VD, BP, TNF alpha, IL-1, TGF beta 1, and HLA. There are a lot of others in the same family. So what happens? Because of the triggering of these inflammatory gene response, patients develop chronic bronchitis, airway diseases, epithelial abnormalities inside the lung cells, and severe respiratory conditions. So what are other inflammatory chemokine receptors which are triggers during these particular cytokines? So those are few again, that is CCR5, CX, CR3, and accumulation of macrophages, neutrophils, followed by CD8 plus T cells. And this CD8 plus T cells expression really creates main problem. So now we understand the cause is, yes, toxic gases or smoking. That triggers the inflammatory reactions, that the mucus formation, and a lot of other problems. And finally, if patient is or a person is not taking care, he may go on the oxygen support, or even sometimes you feel very compromised lung, and even you walk like 10 steps and you start feeling very tired, suffocated. So let's see how we may manage these particular problems using stem cells. So it is quite obvious to understand if somehow we may neutralize this pro-inflammatory reactions, then it is very possible that we can develop or manage this kind of problems or develop a treatment. So let's see what happens. So we found that this mesenchymal stem cell, which is already well known for its immune modulatory function, and once we inject in intravenous, these mesenchymal stem cell goes and secretes good cytokines, that is anti-inflammatory cytokines, that also do the phagocytosis of bacteria. Because it suppresses the pro-inflammatory cytokines by secreting anti-inflammatory cytokines, so the mucus formation and all these things, which is increased in the lung, that fluid start clearing through the blood circulation. And also the angiogenesis, the formation of new blood vessels and new tissues, starts in the lung, because these mesenchymal stem cell also secretes several cytokines which help in the repair of the damaged lung. So let's see what are these. Like, we know that TNF alpha and all these things are problematic, but it also secretes the VEGF and several kind of pro or anti-inflammatory cytokines, in fact, to neutralizes the pro-inflammatory cytokines. So question comes, from where we get this mesenchymal stem cell? Mesenchymal stem cell, as I told, it is adult stem cell. So there is no problem, basically. It is present almost everywhere in the body. And it has been seen, lung also has this particular stem cell. So we say LMSC, L means lung mesenchymal stem cell. So if we get this lung mesenchymal stem cell to treat the COPD, I think that is the best kind of mesenchymal stem cell to treat the lung with the COPD. But this is not available in enough number and very difficult to get also, or isolate from the body. So what is the best way? So there is another place where these mesenchymal stem cells are present in abundance. Those are our fat cells, fat tissue, belly fat, you can say. So that is called AMSC, means adipose mesenchymal stem cell. It is better than all other kind of mesenchymal stem cells. So we take the fat out, we can take out the mesenchymal stem cell from the fat, and we may infuse this mesenchymal stem cell in the lung. So very easy. And it goes, neutralizes the pro-inflammatory cytokines, secretes the cytokines which enhance the repair of the damaged lung. So it works at two steps: neutralizing the bad cytokines and also repairing the lung. So this is very good, and that's what the publication we suggested. So we see that COPD may be managed using mesenchymal stem cell. But the wonderful news, recently we treated the COVID patient, actually had very severe compromised lung, using the same hypothesis and philosophy. And in fact, the US FDA granted us the compassionate use approval to treat a COVID positive patient. And I feel very happy to report that we treated successfully this patient. So basically, almost all kind of lung diseases, in fact, which is having these kind of problems like pro-inflammatory cytokines and like lung fibrosis, COPD, and even COVID-19. And post-COVID-19 patient, basically, a lot of problems are coming in the post-COVID-19 patient who has multiple organ problems, including the compromised lung, even after the completing their treatment of the COVID-19. So those patients also may get benefited by this particular treatment, that is using the mesenchymal stem cell to repair the damaged portion of the lung. And so that's all I wanted to talk to you today. And thank you very much.
Creating A positive and significant impact for human race is our primary goal. From research to treatment is our purpose.